Then you have the problems with the knee, okay? And how many members are there to an unhappy triad?
3.
Probably 3. And then we need to figure them out. 2 of them make sense because this usually happens with what's called a valgus stress, okay? Genu-valgum is when you're knock-kneed, okay? So a valgus stress makes your knee go in that direction. So a valgus stress makes you go into the genu-valgum, okay? Which means that you're wrenching the medial side of your knee, and you're wrenching open the tibial or the medial collateral ligament, okay? Because the medial meniscus is attached to the tibial collateral ligament, you can get damage of both of them as a natural consequence. And then the third member of the triad is usually the anterior cruciate ligament. Okay, because trauma that usually causes this can wrench the knee, twist the knee, hyperextend the knee, do something to it. So it's not unusual to have all these 3 things injured together. All right. Interesting thing about the ankle joint is that while the fibula participates in there, it's sort of over, really, it's really on the lateral side, okay? So it's on the side, so it's not really taking a lot of weight. The weight of your body is coming down from your knee joint, from your femur to your tibia. The fibula doesn't bear any weight up there either, right? Because the fibula doesn't participate in the knee joint. So all the weight of your body is coming down onto the femur, onto the tibia, and all the way from the tibia is going straight to the talus. Okay? Likewise, a push from below up would go from the talus to the tibia, primarily. Okay? Because they're the 2 joints that have all the weight transfer in between them. Okay? The weight pushing down from the body, the pressure pushing up from planting your foot on the ground. Okay? Once you do that, it's all happening between the talus and the tibia. All right? Okay, that's good. All right, now we want to figure out the drawer signs. Drawer signs. Anterior drawer sign is a movement of the tibia this way. Okay? Anterior drawer sign. Posterior drawer sign. That's the beauty of this diagram if you add this to it. The diagram in the book didn't have this in there. Okay, so I had to draw it in there. So I got out my PowerPoint, got out my Photoshop and stuck it in there. Okay? And then I labeled it this morning. All right? So you can see how this is lined up to prevent an anterior drawer sign. So an anterior drawer sign, positive anterior drawer sign, is indicative of anterior ACL injury. Posterior drawer sign is indicative of posterior cruciate ligament injury. Okay? Got that all figured out? How about injuries down there in your ankle? Well, you can have inversion injuries and you can have eversion injuries. We talked about Pott's fracture being an eversion injury. This is an inversion injury, and inversion injuries are more common than eversion injuries. Okay? We had a big slide that said that during the lecture. And the ligaments that are most likely to be damaged are either the anterior talofibular, because it's small, and especially when you're in plantar flexion, this is going to be lined up sort of more vertically, so it'll get torn with an inversion injury. And if you're not in plantar flexion, then this one is going to be more vertical. That's the calcaneofibular ligament, okay? And that's liable for damage too. And this is a avulsion or fracture of the lateral malleolus off of the fibula in this case, okay? Pretty amazing to me that these 2 little ligaments could actually happen such that they fracture the lateral malleolus. I can see how the deltoid would do it. The deltoid's a monster ligament on the medial side, so fracturing a piece of the tibia off makes sense, but these 2 little guys fracturing off a piece of the tibia, I guess it can happen. This diagram that showed it. Okay. But the posterior talofibular ligament is a monster ligament back here, and it's essentially immune to injury. These 2, however, are likely to be damaged, either one or both, with inversion injury. Okay? tell whether a person is sort of walking a little bit in an inverted position or a little bit of an everted position. Maybe even if they're got genu valgum or genu varum a little bit by shoe wear, okay? So if somebody is wearing out the lateral side of their heel, okay, the outside of their heel, I can't get my foot up there. This is the heel of the shoe, okay? If they're wearing out the lateral side of the heel, that means that they're hitting that preferentially. Okay, so what position is their foot going to be during where the lateral side of their heel? Probably an inversion, because they're inverted when their shoe hits the floor. Okay, all right. So you wear out the lateral side of your heel, like most of us do. Wear out the lateral side of your heel because our foot tends to be a little bit in inversion. Okay. All right. So you can see how that would happen. This is an inverted foot. So you can imagine where the heel is going to be on your shoe. You can imagine which side of your heel you're going to wear off if you tend to be inverted. All right? Okay, where are we? Excuse me. Get some time. Almost time for a break. This is the last thing we'll do, and then we'll take a break, okay? This is a big deal here. See that shelf there? That's a shelf on this bone. That's a shelf on the calcaneus that holds up a talus that's wider than the top of the calcaneus would be without this. You know what I'm saying? The calcaneus has to add this shelf to be wide enough to accommodate a wider talus up above. So this shelf of the calcaneus holds up the talus, the sustainer of the talus, okay, sustentagum tali. But what I want to really emphasize here is this groove, okay? That groove right there. That groove right there is not for this. It's not for Tom, it's for Harry. The groove here that can be painted green or black or red or blue, what tendon passes in this groove is the flexor, not the extensor, right? Because the extensor is on the other side. Keep that in mind, okay? Sometimes multiple choice questions can be tricky. What's there? Choice A is extensor hallucis longus. Gotta be careful. Don't want to choose that one, okay? Flexor hallucis